Welcome back to Your Health Matters. My guest today is Dr. Kathy Nagel, the new oncologist here at KRMC's Cancer Center. Thanks again for being on the show, Kathy.
You're welcome.
So we were talking about the oral medications.
Yes.
You mentioned that there are other medications, not just chemo and radiation. Do you want to tell?
So oral medications are targeted medications, and what that means is that the science has gotten so advanced now that we know cancer down to the cellular level. So at one cell, we know the pathways inside the cell that are turning on and turning off and making a cancer grow.
Wow.
Once you know that information, you can then direct your science to that pathway to try to figure out a way to switch it on and switch it off. And so the oral medications that you would receive are, if you have a particular cancer that has that mechanism we know, we can give that and block it. And that's where all the new science is going to this technology. In fact, technology is even being advanced now. We're going to something called nanotechnology. And nanotechnology is where they will take a small chip and insert it in the cell, and it'll be going through the body and land in an area, so even our imaging is going to be changed where we'll be able to tell better imaging of whether a cancer comes back or not. So there's so many exciting things happening that it blows your mind. You know, every year we have a conference that we go to in Chicago,
Okay, well,
and
that's nice.
it
Get to
happens
go
to
back
be in a
home.
good city.
Yeah.
30,000 oncologists go to this
Wow.
this conference every year. Now the reason that it's so popular is because you need to go to a conference to find out about all the new things, because there's so many different types of cancer. So cancer today is not what it was years ago.
Right.
And it is not today what it will be years from now. And so it's very
Always
exciting,
evolving.
always evolving, always evolving.
So truthfully now, people, when they get that diagnosis, needn't to be as frightened, as scared as they would have been, like you said, 5 years ago, 10 years ago. Their chances for survival are better. There are, like, what kind of symptoms, for instance? How does a person, I mean, well, with breast cancer, we know we watch for lumps, excuse me, have your mammographies on a regular basis, but are there other symptoms that a person?
There are. Change in weight. If all of a sudden you're losing weight and not gaining but losing weight, and you don't have an explanation for it, you're not trying to be on a diet and you're losing weight, or a change of appetite. Actually, you're just not hungry, or a change in the taste of food, where food that used to you like, you don't even taste it at all, and people don't know about that one generally. Of course, pain, undescribable, that you never had before, pain, a cough. We always worry lung cancer still is the #1 cancer for all women and men.
Right.
And so lung cancer we always would like to love to catch early, and unfortunately people often ignore that. And you know, skin cancers from being in the sun, any mole that changes or any new lesion that you find needs to be addressed. And the biggest thing is not to fear cancer, because if you fear it, you're going to ignore it and it's going to grow.
Right.
And with all the new treatments that are out there, we just generally do a very good job. In fact, I tell the patients too, because cancer is not what it was years ago, if you have someone you know that have had cancer, your cancer's now a different animal, if you will,
than
it was
parents
before.
or
Exactly. So
grandparents.
their experiences with the treatments are going to be different. I mean, rarely, you know, on TV when you watch shows, you see people vomiting and they're very sick to their stomach.
Right.
We don't have that. If I did, I wouldn't have any patients to see. But we don't have that. We have such strong medications to give them to prevent that from happening.
Oh, I did not know that.
And that's the biggest fear people have.
Right.
When they're afraid that they're going to have nausea and vomiting, and they're afraid of pain. And we don't have that.
Wow.
And
That's important for people
It's
to
very
know.
important for people to know. And but at the shows that you watch on TV, of course, nobody would watch them if it wasn't a little dramatic.
Have that blood and gore kind of thing.
Exactly. So.
Well, and I've shared, you know, one of the first tasks when I first started at KMC was the ribbon cutting for our cancer center in 2004. And even then for me, it was what a gift for our community, because until then, of course, people had to go to Phoenix or Vegas for their chemo and radiation treatments. And I've always thought that when you're sick and the treatment well, what I thought, that the treatment would make you sicker,
Right.
that the last place you want to be is in a hotel
That's
room
true.
with strangers and away from your family. And
Right.
for us to have been able to bring this, I consider it a gift to the community, where you're able to stay home and
Yes.
go home after your treatment and
Right.
have your family and friends with you. That's got to make a huge difference in your recovery even.
It's huge.
Yeah.
It's huge.
And you're right there.
Right.
So if you have problems.
Right. The importance of family is very important, but it's interesting to know that because Kingman has a lot of people that have retired to this area from the entire country,
Right.
a lot of families now are asking for these patients to come back home with them, and they're saying, no, I could get my care at Kingman. I don't want to go home. I feel comfortable in my own home. I feel comfortable in my own bed. So it kind of reiterates what you're saying. People are more comfortable, even if they have their daughter or family outside.
Yeah.
And, you know, and again, their family, I usually just talk to their family over the phone and say, Mom is going to be okay. She's not going to be sick like you think.
Yeah,
you know,
she's in good hands.
Exactly.
Well, and I think, like you've said, that sometimes there's that misconception because we're a rural community. They don't realize that we do have state-of-the-art technology here.
Exactly.
That a lot of the bigger hospitals would give their
Right.
ITs for.
Exactly.
We talked about the IMRT. Is there other equipment or technology that we have at the Cancer Center that's unique or special?
Most of just the medications that we have, and you know, the thing to know too, even for our imaging is state of the art for our breast imaging.
So that your
we have-
diagnostics.
yes, and that's amazing. In fact, so advanced that I don't even know all the the details about all that work. But it's important for patients to realize that the care that they get here in a community setting is the same as it is nationwide. And unless you have a very rare disease, which I would send out anyway, and anybody from a community setting would send it to a larger facility, because there are oncologists in the world that only treat one type of cancer. They spend their entire life only doing one cancer, but not only breast or not only lung.
Right.
It's very specific types of, not even a breast, but of a lung cancer, for example, or a melanoma. And because of our knowledge being maybe unknown about certain types, that we send people to the big centers, and we will do that too. We're not going to ever compromise a patient's health,
Right.
Because we don't have something here. And but the chemotherapy that we give here is the same as it is anywhere in the world. It's all FDA regulated, and it's all the same.
Okay,
and
that's good
that's
to
good
know.
for people to
right.
know.
And I just feel so much better you telling me that about people not getting so sick
Right.
now from
Oh,
the
yes.
treatment. That's huge. So at one time I remember someone saying to me, well, you're never cured of cancer. Once you've had cancer, that it's always a possibility that it could come back. So
That's true to a point.
Okay.
You are cured of the cancer, but anytime you have a cancer, you're always at risk of another cancer.
Okay.
Because of the genetics of a cancer, it could be in a genetic. You can be genetically predisposed to have a cancer. I had one patient that had 7 malignancies in her lifetime.
Wow.
And I can't even imagine having that. I mean, she coped and she had to deal with, but she had a family. You know, that's very rare to have something like that. But the point of the matter is that once you have cancer, you should be followed by an oncologist on a routine basis, just so that the warning signs can be there, because you still, even if it recurs, want to catch it early. And you also don't want to avoid having other health screening. For example, if you have a breast cancer, it doesn't mean you can't get a colon cancer. So you should have your regular colonoscopy at the age of 50 and talk to your primary care doctor about what should I have done for myself. Pap smears, you know, digital rectal exams for men for the prostate, and the common, you know, cancers that people will get. And in that, you just keep yourself healthy, just as you would if you were a diabetic and you have your blood pressure checked and you have your heart
blood
checked.
sugar and
Same
all those
exact
things.
thing.
Yeah, okay.
And it's just for good health.
So that's, you know, it is good to know. Again, like I said, that it's not the scary diagnosis that it used to be, and we are so blessed to have had you join our team, and the level of patient care and your empathy with the patients is amazing. And I know that I've talked to folks who have already seen you, and it's just, they're just thrilled
No,
to
well,
have
thank
that
you.
level of care here. You know.
Well, I will tell you, I get more from my patients than I can possibly ever give them, but thank you for that.
Oh,
Thank you.
well, you're welcome. We're glad, and I appreciate you taking time to be on the show today.
Oh,
It's
you're
great
welcome.
to have
Thank you for asking me.
You're welcome. And if anybody has any questions, they can call my number at 757-0664. We also have information on our website at www.azkrmc.com. You can go to Find a Physician and look up Dr. Nagel and see her bio there and learn more about her. And we're always having events coming up. We have the Women's Health Fair on October 17th, and I hope you'll join us for that. It's from 10 to 2. And thank you for joining us today. Join us again next week. We'll have a different guest.